Pressure. Pressure. I know a little something about pressure, so I'm going to live into it. I'm going to hang with you all. My daddy was a faith leader, and he would tell me all the time to be sure that whenever speaking publicly that I never follow a preacher. He said nothing about Greg Morris. I'll take that up with him when I get to heaven. It's good to be here. It's very good to be here this morning. You know, in these times, this moment, it's so important to surround yourself with people who are showing up and pouring into themselves as they pour into others. And that you've all shown up in this moment tells me that you're doing just that. That's what we need to be doing in this moment. We're no good to anybody else if we're not showing up and pouring into ourselves as we pour into others. So I'm glad, I'm honored, I'm delighted to be with you this morning. And I'm just very thankful, very appreciative to both Jennifer and to Greg for gifting me the honor of sharing with you my thoughts and reflections this morning. Their doing so tells me that they see me. They know that I'm trying to do my part. And that's what you need. You need people cheering you on, right? In these difficult moments. I want to thank you, Jennifer, and I want to thank you, Greg. And I also want to tell you that had I known at the time that I accepted the invitation to come and to speak, that Speaker Adams was keynoting yesterday, would be keynoting on the first day, I probably would have said no. I probably would have thought otherwise, but here I am. The challenge is before me, so let's go. What I'm going to do this morning is help us to talk about the intersection, center on the intersection of policy and practice. I'm going to be that bridge this morning that moves us from policy to practice. A few days ago, as I was gathering my thoughts for today's talk, I began reflecting on the times in which we're living. In just under 50 days, 47 days to be exact, we will have a new president, a returning president, whose proposed policies and cabinet nominations should concern anyone who's about the business of helping people. And in just 27 days, we will be full on in the mayoral election race, with Mayor Adams seeking re-election while preparing for trial on federal charges, and while running a city with a president that he's got to dance with for a host of city reasons and personal reasons. As I reflect on this moment in our nation and city and in our lifetimes, 3 words come to mind: difficult days ahead. Difficult days ahead. History teaches us that these 3 words were spoken by Reverend Dr. Martin Luther King Jr. in his last speech, which he gave the day before he was assassinated. It was the evening of April 3rd, 1968. Dr. King was speaking to a large crowd of Black sanitation workers, community members, and faith leaders gathered at the Mason Temple in Memphis, Tennessee. He was in town to march the next day in solidarity with the sanitation workers who were striking against the city of Memphis for mistreatment and discrimination in the forms of low and unequal pay and no pay on rainy days compared with their white counterparts. Poor working conditions such as no uniforms, no place to wash up, work with unpaid overtime, and deathly dangerous equipment to work with, and lack of union recognition and pay for workers' compensation. Speaking about the enduring fight for economic justice for Black Americans and the hostility and violence they'd already been confronted with in Memphis and other parts of the South, and also of the resolve to press on anyhow, because it was the only way forward in the pursuit of fairness and equality, Dr. King declared, "Well, I don't know what will happen now. We've got some difficult days ahead. But it really doesn't matter with me now because I've been to the mountaintop and I've looked over and I've seen the promised land. I may not get there with you, But I want you to know tonight that we as a people will get to the promised land. As I prepared for today, I reflected on Dr. King's words, and I thought about the Black sanitation workers with whom he was standing and the similarities in their hardships with those faced today by persons seeking workforce development training and supports, and even nonprofit workers engaged in the practice of workforce development, all seeking equal and fair livable wages and compensation, safe and meaningful work, and job security, and all challenged by government-structured and supported economic deprivation. Dr. King prophesied that there would be difficult days ahead, and indeed there were. And though I'm no prophet, just a lawyer looking at facts, I too am led to predict difficult days ahead. As we experience with the 2024 presidential election, our nation is divided, and possibly our city more than we realized. The campaign cycle was fueled with divisive rhetoric about immigrants, about persons of color and DEI and affirmative action, Black jobs and Hispanic jobs, and promises to end funding for supports intended to level the playing field for marginalized communities. And now the transition is underway to move from just talking to actually doing, to dismantling the strides that have opened the doors for countless individuals and families seeking true economic security. All while the field of workforce development already grapples with too few jobs, especially for persons without post-secondary degrees that pay living wages that support individuals and their families, and with workers too often not possessing the requisite skills to fill better paying jobs that don't require college degrees. All while the field and clients are challenged by barriers that make work not worth it. Just to name a few, childcare expenses exceeding or cutting significantly into take-home pay, and justice-involved histories keeping certain jobs out of reach for many. Perhaps those who are seeking those jobs should seek the presidency of the United States. Just saying, just saying. All while the field braces for the impact, good and bad, of artificial intelligence on low and middle skilled jobs. Difficult days ahead. The likely impact of President Trump's tax reform promises, plans to cut even more than he did in 2017 in ways that again would disproportionately advantage business and wealthier individuals and families, and could result in significant annual federal revenue losses. Plans that could cause substantial cuts in federal funding for New York City for critical services and supports for low-income individuals and families. FPWA's federal funds tracker tells us that in 2024, New York City received $11 billion in federal funding, which represented 10% of our city's revenue. A significant portion of this federal funding supported cash assistance, housing subsidies, child care subsidies, foster care, elderly supports, education supports, emergency food supports, workforce development, and more. Substantial cuts in federal funding will impact services to those already vulnerable, and many, many more here in New York. Additionally, President Trump's mass deportation plans will greatly impact New York City. Up to 500,000 people, 500,000 New Yorkers could be at risk of deportation. They and their families will be directly affected, as will New Yorkers who benefit from the services they provide. Our local economy will be negatively impacted as well, which in turn will impact city revenues. Mass deportation would deprive federal, state, and local governments of billions in local tax contributions from undocumented households. In 2022 alone, undocumented immigrants' households paid $48.6 billion in federal taxes and $29.3 billion in state and local taxes. All of these actions anticipated to be taken in 2025 will have budgetary implications directly on the communities and the agencies that we serve. And in the immediate and the long term, less funding as the need for assistance, workforce development included, only grows. Indeed, difficult days are ahead. And all the while, economic security becomes increasingly unattainable for low and middle income Americans. If we didn't know it, the general election made it abundantly clear. Despite traditional economic indicators trending positive, job growth, consumer spending, and GDP growth, exit polls and surveys consistently pointed to the economy as the #1 issue, and voters' negative views about it. And why? Because jobs that don't pay meaningful wages don't pay the bills or allow for savings to build assets or weather an economic storm. Doesn't matter what government considers positive signs of economic stability. If the true cost of living securely in this nation, in this state, in this city, exceeds the resources available to many families. This reality is on full display here in New York City, where the high cost of living and stagnant wages leave too many families struggling and more middle-class families fleeing. Indeed, difficult days are ahead. They're upon us. And how we show up and respond will make all the difference in this moment and in the years to come. Our efforts must address the needs of New Yorkers in the moment and in the years to come. Our efforts going forward must be both programmatic and structural in nature, centered on poverty management and eradication, alleviation and liberation. Now, I'm not as expert in workforce development as many of you in this room, but I am knowledgeable and experienced in matters critical to making work pay, beginning with actual pay. For so many of the individuals that you're serving and supporting, base wages leave them still challenged. And for some, the more they make, the less eligible they are for income supports, such as food, transportation, and childcare. For many, occupation segregation is a work hazard. If you are Black or brown, you are more likely to be placed and to work in jobs that pay significantly less. Interestingly, the research shows that if you are Black and a woman and you earn your way up to a job in a field that pays more, over time the field will soon enough pay less. Our efforts have to include both the training that prepares people for work that pays fairly and the advocacy that brings an end to occupation segregation with disproportionately or lower pay. Our efforts also have to include advocacy for an increase in the resources, as Jennifer talked about, the resources that complement and subsidize earned income. Resources like subsidized childcare and 3K for all, which in New York City are vital to ensuring families, low and increasingly middle-income families, can live and work and raise their families here. And our efforts have to include advocacy for funding for trauma-informed care. Not all, but many people in need of workforce development supports are grappling with and managing challenges that have inhibited their ability to be employed, gainfully employed. Some have had learning disabilities, learning challenges. Some have been justice involved. Some have been unemployed and underemployed for so long that their beliefs in their abilities have been diminished. Many are dealing with trauma that can impede their progress. At FPWA, we've learned how valuable and how critical trauma-informed care is for nonprofit workers, caring for and supporting others. We've been providing our member agencies with trauma-informed care training since 2020, and every year, the demand only grows. trauma-informed care that helps workforce development professionals see and address the mental and emotional barriers that present when people are entering and re-entering work is crucial. It's vital, and there just isn't enough support for it. There's very little government support for it. Our efforts have to include advocacy for trauma-informed care. These are but just a few of the attendant issues in workforce development that can't be understated. For so long, we've been operating under the funders' false narrative that workforce development training alone can fix it, can ensure upward mobility and financial security. But not so when barriers to work and pay that helps ensure economic security, those barriers persist. One of the greatest barriers, structural barriers, to work that pays is structural economic deprivation, which upholds economic insecurity. Structural economic deprivation is a term. It's a term that I've coined. How dare I believe I can coin a term, but I'm doing it. Structural economic deprivation is yet another social construct created to normalize and enable systemic limitations on the ability of lower-income people and communities to access the financial, health, education, and social resources that build and sustain wealth, thereby all but ensuring a socioeconomic strata with individuals, families, and communities living perennially in or near poverty. Structural economic deprivation is upheld through false narratives about deservedness and wealth, who is worthy and who is not to live with dignity and economic freedom and to be able to plan for themselves and their families, and through classifications based on income, not wealth, on income, all the while knowing that wealth is what ensures economic security in America, not income alone. Structural economic deprivation is upheld with policies and practices that withhold or inhibit access in real time to critical resources for low-income and low-wealth families, such as tax policies that withhold earned income from lesser resource families when they actually need it, and income support eligibility restrictions that prohibit meager savings, and through government measures of need that are based in acute material deprivation and subsistence, such as the official poverty measure, which undercounts what families need to survive and thrive. Greg talked about it. The official poverty measure is based on the cost of food. It says that a family of four living anywhere in America needs just $31,800 to not be poor. Anywhere in America. Just $31,800 to not be poor. $31,800 is the federal poverty level for a family of four anywhere in the United States. That threshold is then used to determine eligibility for several critical income supports at the federal level, at the state level, and at the local level. And it's also used to justify the federal minimum wage of $7.25 an hour, which when annualized is $15,000 for one person and $30,000 pre-taxes for two. For a family with two children and two adults making federal minimum wage, they would be considered to be just slightly under the poverty threshold at $30,000. The official poverty measure is configured intentionally, willfully, to justify ridiculously low minimum wages, upholding structural economic deprivation. Now, back in 2018, as the New York State minimum wage was raised to $19 for all, we at FPWA were concerned, like Jennifer, about the benefits cliff. So we undertook a study to assess the risk of New Yorkers falling over the benefits cliff, earning an additional dollar or two, and being pushed over the eligibility edge for critical income subsidies far greater than their wage increase. Engaging with people from all 62 counties across the state, we quickly learned that the benefits cliff would be a problem for some, further inhibiting their ability to make ends meet. And we learned that there were many, many others already earning well above the new state minimum wage and still unable to make ends meet. However, they were not being seen and supported by government policies and programs. The official poverty measure didn't see them. Traditional economic indicators didn't see them. These are the people making 200 to 500% of poverty, as much as $160,000 for a family of four, some classified as middle income and struggling. In New York City and across the state, they can pay for rent and put food on the table, but they can't save for their futures. And they can't repair their car when it breaks down, even if they need a car to get to work. They can't afford to call an ambulance to go to the ER without having to delay or forego payment on their everyday bills. In 2019, our work of challenging long-standing official measures of poverty based in acute material deprivation began in earnest. And in 2022, our research, it's good to be the chair of the Racial Justice Commission. Our research informed the New York City Racial Justice Commission's ballot measure, asking New Yorkers to decide if the city should annually calculate the true cost of living. Not surprisingly, with more and more New Yorkers low and middle income feeling the pinch of covering daily living costs and trying to save for a rainy day and for their futures, the measure passed. Over 81% of New Yorkers said yes. People from all over New York City were demanding that the city look more closely at their financial struggles and use the data to inform policymaking that would materially, positively impact their circumstances. Like many New Yorkers, people across the nation are feeling the pinch, and they're feeling overlooked by government. So in 2023, FPWA engaged and partnered with the Community Service Society and co-established the National True Cost of Living Coalition to call for the creation of a national measure that sees everyone, not only those barely surviving, that moves beyond poverty and basic needs to center on economic security as the standard for all Americans' well-being. We know from our work that the official poverty measure and other need measures center on subsistence, including the self-sufficiency standard, not true economic security and thriving. And we know from our work that traditional economic indicators often do not directly align with lived experience. Earlier this year, we conducted a nationwide poll, and that poll found that 46% of Americans, including those considered to be middle income, with incomes greater than 500% of poverty, have less than $500 in savings. The coalition determined that America needs a way of seeing them, that federal, state, and city lawmakers must see them and their financial challenges. And so we commissioned the internationally renowned think tank policy organization, the Urban Institute, to develop the measure. And just 2 weeks ago, the measure was released. And now, for the first time in our nation's history, we have the first ever groundbreaking true cost of economic security measure, a tool that truly helps us to understand what every American, not just the deserved, not just the wealthy, but what every American needs to be economically secure. TCS calculates county by county across the country both the cost of essential living expenses, including the price tag of daily needs such as housing, food, childcare, and healthcare, and debt and savings, and the amount of resources available to individuals and families to meet those costs. It then algorithmically determines the threshold for being able to manage these costs at county, city, state, and national levels. The potential for this measure to positively inform and impact government and private sector decision-making is revolutionary. And if you follow me, you know I'm a revolutionary. Because the measures go beyond looking just at basic needs. which is what those who want to uphold structural economic deprivation want every one of us in this room to do. Government, sometimes philanthropy included. The measure goes beyond looking just at basic needs. It fundamentally shifts the discourse from subsistence to economic security, from what families need not just to survive, but to thrive. With TCS, which has garnered the attention and endorsement of White House officials, congressional leaders on both sides, national policy experts and advocates, economists, business leaders, academicians, service providers, civil rights leaders, and more, we're going to close the gap between traditional economic indicators and lived experience. And in doing so, we're going to provide policymakers and influencers like yourselves with a powerful tool to inform decisions that directly affect the needs and aspirations of Americans. Decisions such as what is a fair, livable wage? What is fair and equitable tax policy? What is affordable care, health care, appropriate thresholds for child care and housing subsidies, and more. In the difficult days ahead, our efforts to ensure unemployed and underemployed people obtain jobs that pay must also center on true economic security, the true cost of economic security. And we have to do this in unity, my friends. Another line in Dr. King's speech that evening makes it plain when he states, now what does all of this mean in this great period of history? It means that we've got to stay together. We've got to stay together and maintain unity. You know, whenever Pharaoh wanted to prolong the period of slavery, structural economic deprivation, he had a favorite formula for doing it. What was that? He kept the slaves fighting among themselves. But whenever the slaves get together, something happens in Pharaoh's court, and he cannot hold the slaves in slavery. When the slaves get together, that's the beginning of getting out of slavery. Now let us maintain unity. In the days ahead, as new proposals and plans that would reduce federal funding for critical services and supports are advanced, we have to resist the temptation to be concerned only with the one or two issues that affect our organizations. Workforce development is only as strong as benefits and work supports, and efforts aimed at dismantling structural barriers to economic security. We have to be united. And lastly, we have to lead with a sense of purpose. Dr. King began his speech that evening in Memphis with words about the challenging times in which he was living. He said, if I were standing at the beginning of time with the possibility of panoramic view of the whole history up to now, and the Almighty said to me, Martin Luther King, which age would you like to live in? Strangely enough, I would turn to the Almighty and say, if you allow me just to live a few years in the second half of the 20th century, I will be happy. He went on, now that's a strange statement to make because the world is all messed up. The nation is sick. Trouble is in the land, confusion all around. That's a strange statement, but I know somehow that only when it is dark enough can you see the stars. We have been forced to a point where we are going to have to grapple with the problems that men and women have been trying to grapple with through history, but the demands didn't force them to do it. Survival demands that we grapple with them. For King, even as he painted a bleak picture of the times, he embraced that it was for him the best time in which to live. He believed that to live in a period of great strife and uncertainty is not happenstance. It's purpose. Living with purpose. Greg shared or alluded to that I had an experience, a near-death illness, several years ago, 15 years ago. I woke up on a Friday morning with a flu-like fever, and just 1 week later, I laid in a hospital bed, comatose, with tubes stitched to my neck and my throat. The doctors had determined I had cancer, and they told my husband that I was going to die in 48 hours. They gave me a 1% chance of living. Now, here's what we all know happened. They were wrong. I got a chemotherapy treatment, and I survived, right? But here's what happened, and thank you. Thank you. When I came out of the coma, I learned that I had a type of leukemia with a broken chromosome. I was in 9/11. The doctors believed that it was environmentally caused. And that broken chromosome had rendered my blood and bone marrow system deficient. In order to survive the disease long term, I needed a bone marrow transplant. I needed an adult to give me some of their good blood and bone marrow. I needed someone of similar genetic typing. I needed a black brother or sister to give me some of their good blood and bone marrow. Now here's the problem. Because of the great diaspora, and I'm cleaning it up, forced and unforced, it's very difficult for people who are black, of African descent, to find in the bone marrow registry someone of similar genetic typing. So the chances of me surviving were even more small, even after coming through that first round, that first bout. We commenced a search nationwide to find me a donor. Largest number of people ever added to the registry. My husband was like, you know, I love her and I like her too, so I'm not going to let her die without trying. And we brought more than 13,000 people to the registry in 13 weeks. The beautiful thing was that many people who were in need of bone marrow transplants started receiving transplants from people who came forward to me. For me, community taking care of community, right? Purpose, if you will, in the suffering. I didn't get a bone marrow transplant, but I did get a cure. And for that reason, I'm here today. Now, what I believe is that just as my suffering had purpose, my living has purpose. There's a reason that I'm still here. I would talk to my children while I was going through the ordeal, and I would say, being a person of great faith, I believe that God gives us life to help fulfill God's purposes. And when we fulfill those purposes, God calls us home. That I'm living today is because I have purpose. My friends, because you are living today, I am convinced you have purpose. You have purpose in this moment. And that purpose is, in this moment, to lean in, to lead with a sense of responsibility greater than maybe you've ever imagined possible, to believe that more is possible in this moment. So what I want you all to do, what I implore you to do in this morning, as you step up for individuals and families and communities, maybe that are like yourselves, maybe that are not, to lead with this sense of purpose that more is possible in your practice, to center not just on the moment, but how you can impact lives for a lifetime, for generations to come. Do you hear me? Our nation is at an inflection point. Do we dig deeper and further entrench our society in structural deprivation, ensuring opportunity for the elite few, or do we take the ideal of democracy and strive to make it what it should be? The nation's at an inflection point. Our city, too, is at an inflection point, every day becoming more and more unaffordable for low and increasingly middle-income New Yorkers. Our city's at an inflection point. The societal ills of our time, too many to list, all disproportionately affecting the individuals and families we serve and support, even affecting many of us in this room. We can't keep doing just more of the same. Do you hear me? You can't, we can't keep doing just more of the same. And so this morning and throughout the day and in the days to come, I want you to center on purpose. Our city, our state, our nation need us to lean in and lead with purpose. Not just to sit at the table, but to turn the table over, if we must, okay? Not just to shake hands with government officials and business leaders when they pacify us with what amounts to pennies, but wrestle with them for real money, if we must. not just to accept false narratives about who is worthy of economic security and who should be happy to just have enough, but vehemently reject them because we must. That each of us is living in this moment, in these difficult times, means we have purpose. Let's lean in and let's lead with purpose and make the world, make the state, make our city better than what it is. We can do it, one worker at a time, one city at a time. Now let's get to it. I wish you a great second day. Thank you.